Welcome to the video user guide for the Pulmodyne MaxShield Total Face NIV mask, the only style mask that eliminates all nasal pressure sores. This video guide will provide an overview of sizing the masks, each key feature and using them to full effect, our recommended fitting procedure, managing the leak from the mask, and finally, maximising patient tolerance and comfort during therapy. The MaxShield mask is available in 3 sizes, the small, large and extra large, with 2 sizing methods available to confirm the correct fitting. The first and most common sizing method for the MaxShield mask is a large reusable card containing a guide hold for the correct face size. As the small picture on the sheet shows, hold the guide over the patient's face, placing the bottom edge just underneath the lower lip. If the top edge of the guide sits just over the eyebrows, you have the correct size of mask. If the top of the guide begins to cover most of the patient's eyebrows, the mask will be too small. Alternatively, if there is a large gap between the eyebrows and the top of the guide, the mask will be too big. When finished, simply clean the guide with a disinfectant wipe to be used again and store. The second sizing method available is a small single-use guide, which provides a good backup option if a reusable guide is not available. Before using the guide, ensure you have the correct side, which says MaxShield sizing by the bottom arrow, as it also sizes our oronasal mask, the Pulmodyne Bitrack. Once you have the correct side, point the arrow at the bottom of the guide just underneath the patient's bottom lip, like the reusable guide. Now, imagine a line coming outwards from the patient's head just above the top of the eyebrows. This line will intercept one of the size zones on the guide. This is the correct size for the patient. If you feel the patient is in the middle of 2 sizes, begin with a large, as this fits up to 80% of patients. You can then adjust the mask size later if required. If you feel your department is running low on sizing guide stock, contact your VentMed representative or email info@ventmed.com. The headgear is secured to the top of the mask by Velcro straps on both sides of the interface, which are pulled through and attached to tighten. These contain a second Velcro tab, which can be used to reduce to the size of the headgear for smaller heads or patients with little or no hair, without causing excess strapping. Simply pull the second Velcro through the loop and stick down. The remaining strapping can simply be removed by cutting or stuck down to the headgear. There are also 2 Velcro straps in the centre at the top of the headgear. Tighten to prevent the mask falling under the chin, or if you feel there is leak coming from the top of the interface. To attach the headgear to the bottom of the mask, place the clips at the angle shown and push down onto the top to lock it into place. You should hear a small click when attached. To remove, simply bring the clip to the same angle it was attached, place your thumb on top and turn towards yourself in a key-like fashion. If a clip is ever lost, simply pull the strapping through the loop on the mask and use the Velcro tab to stick down. The mask elbows are removed and attached through a bayonet-style locking mechanism. To attach, insert the knobs on the elbow into the grooves in the attachment area. Hold the attachment area to prevent spinning and twist the elbow to lock it into place. To remove, repeat this process in reverse. The bayonet elbows come already attached to the masks. Therefore, unless removal is required, simply connect the ventilator tubing to the elbow to begin therapy. The Pulmodyne MaxShield has 3 oxygen entrainment ports in the interface, with 2 found at the bottom of the mask, and 1 under the elbow. Before and during therapy, check each cap to make sure it has not come off or been removed. If you see one has come off, simply recover the port with the cap and continue therapy. If the cap has been completely removed and lost, additional spares are available on request. Once you have established the correct size mask, remove from the bag and begin by tightening the first Velcro tab at the top of the headgear until it reaches the edge of the material. Repeat this on the other side of the mask before flipping the headgear over the front of the interface. Next, bring the mask up to the patient's face. To improve tolerance, encourage the patient to do this themselves when possible. Before proceeding, allow the patient to take a few breaths to adjust to the sensation of the therapy. Next, flip the headgear back over the mask and patient's head. The mask should now rest in position on the patient's face, allowing you 2 hands to attach the clips and make any further necessary adjustments to secure. To optimise leak, firstly make sure you have the correct size for the patient, which will allow leak to be more manageable if correct. Check the strapping has been secured correctly, remembering to use the second Velcro tab for patients with smaller heads. You should be able to get 1 or 2 fingers between the headgear and the patient's head. If this isn't possible, it is likely to be fitted too tightly. Ensure your ventilator is on the correct setting for a total face style mask. For example, on the Philips V60 it is setting 2. Aim for a leak between 20 to 60 litres per minute. Aiming for 0 would lead to over-tightening and likely cause discomfort for the patient. Check all 3 oxygen entrainment port caps if leak is unexpectedly high. Remember, spares of these have been provided in the event of a loss. To optimise patient tolerance and comfort, firstly ensure the patient and the ventilator are synchronised. Secondly, ensure the plastic screen is kept clean to allow the patient clear vision during therapy. Clouding may induce feelings of claustrophobia, therefore remove as soon as possible. Educate the patient before and during therapy. If they understand better what is happening, it will relax them to the procedure. Public Health England recommends the use of opioids or low-level sedations to improve tolerance when required. If you would like to learn more about VentMed's full range of NIV interfaces, including the paediatric MaxShields and CPAP hoods, please contact your VentMed representative.